Are you setting yourself up for the smoothest recovery after your gynecomastia surgery? Let's get into some tips that can help you sail through the recovery period as easily as possible. But before we do that, we have to talk about what you can do before surgery to build the foundation you need for that smooth recovery. Let's start with the 3 things you can do before surgery that will make your recovery process even easier. Starting about a week or 2 before surgery, start trying to sleep on your back. This may not sound like a big deal, but come post-op week 1, when you have to sleep on your back and you're a stomach or side sleeper, it's going to be a bigger deal. I need you to sleep on your back so that you aren't putting any shearing forces on your wounds, which in turn will help decrease the risk of wound breakdown or even post-operative bleeding. Try to align a bunch of pillows along each side of you to keep you in a valley to sleep in. Remember, you're doing this in hopes of keeping you on your back for the first couple of weeks during the post-operative period. Just like anything that you train for, if you've trained to sleep on your back for a couple of weeks before surgery, it will be that much easier to sleep on your back after surgery. The next thing you need to do that will make your recovery that much easier is to set up a support system. Make sure you have someone in your life that can come and help you with certain things after your surgery. You're going to be pretty sore after surgery, and you won't be able to do any heavy lifting or strenuous activities. So you're going to need to ask for help with things. And believe me, I know what you're thinking right now. You're thinking, I don't want to be a burden on anyone. I don't want to inconvenience anyone. I get it. That's how us guys think. But with this surgery, you are going to have a much easier time in recovery if you have someone there to help you with certain things. If you have a spouse or a significant other, it will be easier to ask for that type of help that you're going to need. But if you don't, then you need to reach out to your family or friends to get that help. Trust me, you won't regret it. The last thing to do before surgery is to start working on your mental health. You might think that sounds kind of weird, but if you aren't in the right headspace before surgery, you may have your mental health take a dive in the first few weeks after surgery. And that's either due to the expectations on how your chest should look so soon after surgery, or even due to the medications that you're taking. Now, the vast majority of you are going to sail through the post-op period with your current mental health just fine, but not everyone's the same. So it's best that you have someone to talk to, whether it's a longtime friend that you've known forever, or maybe even your significant other. On the other hand, if you would rather talk with strangers on the internet, there's an amazing supportive subreddit all about gynecomastia where you can ask questions and get some support. I'll leave the link down below so you can check it out. Now that we've talked about what you can do for recovery pre-op, let's get into what you can do for your post-op recovery planning, and we'll start with your medications. You've more than likely been prescribed some pain narcotics to help out with the post-op pain, and you should use those if you need them, but you should also get off them as soon as you can, typically within the first 2 to 3 days after surgery. I recommend to my patients to try and get on extra strength Tylenol within 2 to 3 days and keep the pain narcotics as backup when they really need them. By switching to Tylenol sooner, you'll have a clearer mind and you'll decrease your chances of prolonged constipation as well. And speaking of constipation, make sure you have some medications to help keep your bowel movements going, like Dulcolax or Colace, so you won't have to leave the house just in case that happens. The last thing you want to do is develop a hematoma a few days after surgery just because you were straining too hard on the toilet and then ruptured a blood vessel in your chest. So do yourself a favor, get some stool softeners, take your first dose the day of surgery so you don't get constipated because of your pain narcotics. Next up, let's talk about how supplements are also great for a smooth recovery. Supplements like magnesium will help with constipation by drawing water into your intestines, making it that much easier to go. Magnesium also regulates your calcium ions, preventing them from acting on your muscles, which in turn can help them relax and help with any muscle soreness you might have afterwards. Daily multivitamins can help you provide better nutrients for healing as well. Elements in a daily multivitamin like vitamin A and vitamin C can help with collagen deposition at the wound site. Vitamin E can help boost the immune system as well as decrease postoperative pain and swelling. Vitamin D is also known to boost the immune system, and even the vitamin B complexes will help in your recovery. Another option is CBD oil, which you can start using about 1 to 2 weeks before surgery to help ease any anxiety about your upcoming surgery, but it also works great for post-operative pain control as well. I would not recommend taking this before work though, as it can make you feel a little sleepy. So it's best to use it as directed whenever you're at home and don't plan on going anywhere the rest of the night. Probiotics are also going to help with a smooth recovery. These are going to help keep your intestinal flora healthy while you are taking post-op antibiotics. Your antibiotics are going to decrease the risk of an infection, but are also going to kill off a lot of the beneficial bacteria that you have in your gut. So to offset that, it helps to eat probiotic foods such as probiotic yogurts or take probiotic supplements. Arnica Montana. This is a great supplement to take post-operatively that will help with the bruising and swelling that's going to happen after surgery. It comes in a gel form to rub on the skin or even in a pill form to take by mouth. This is a homeopathic medication, so you should be able to buy this over the counter without a prescription. Next up is your ever important compression garment. This garment is going to be your best friend because you are going to be wearing it night and day for the first 6 weeks if you've had a lot of lipo and a large amount of gland excision. It helps to provide compression in the first few weeks to help get rid of a lot of the swelling sooner, and also allows your results to shine through a little sooner as well. If you've had pretty extensive liposuction of the chest and sides of your chest, it's a good idea to wear your compression garment during the day only for another 2 to 4 weeks after that first 6 weeks. That's going to help with any swelling that might be taking a little longer to resolve. By wearing it during the day, you get the benefits of the compression, and it also helps support the tissues as you get back into your exercise routine. I have some patients that wear it running during the first few months because they just felt more comfortable with it on. Eventually, all those weeks are going to pass, and then you just won't need it anymore. And since you'll be wearing that garment frequently, you may want to consider getting a second garment to keep that in the rotation. That way you can have one for exercise or one that can be in the wash and the other is ready to be worn. The next thing you need to prepare for during your recovery is massaging, because you are going to be doing a lot of it over the next 2 to 3 months. Massaging is really important to help break up the scar tissue and to help keep a nice smooth contour of the skin and soft tissues. I recommend my patients to start massaging gently during the first week after surgery. This can be done on your own, but I prefer that my patients go for a professional lymphatic massage during the first week after surgery and do about 2 to 3 sessions per week for at least the first 2 weeks. And to learn how to do your own massaging, you can watch this video right here where we cover all the techniques on how to massage your chest after gynecomastia surgery. I'm Dr. Paul Pearce, and I hope you learned something today. I'll see you in the next video.